Thanks so much, Jose, and very nice to see you, and also Peter. We've been dancing partners in a couple presentations, so I appreciate the complementarity of the angles. Um, I'm Jose has already talked about what. Here we go. Great. I'll leap right in. Um, I'm going to move into talking about some of the sentiments about the COVID vaccine. I founded and direct the Vaccine Confidence Project. We were that founded it 10 years ago, actually, after my previous role in UNICEF, where I saw this growing epidemic of questioning and refusal around vaccines in a number of countries in the world, and felt like we really needed to understand it. Our group does 24/7 social media monitoring, qualitative research where we start to see problems, and we developed a vaccine confidence index, which we launched in 2015. And about 2 weeks ago, we published a large paper with the Lancet, and that was called Global Trends in Vaccine Confidence. And one of the reasons for the index is we kept saying, oh, it's getting worse or it's getting better, but we had no benchmark. So the confidence index gives us a benchmark, at least from 2015. And we've been running this in particular countries that have been asking for it. We collaborate with the European Commission 2015, 2018, 2020 with Wellcome Trust in 144 countries. And all this data we've pulled together in one paper looking at trends over the last 5 years. What do we see? Well, actually, the Financial Times took the raw data from our paper and made this figure, which I think was a nice capturing. There are 4 domains in the confidence index. We ran many, many questions to come down to these 4. People's confidence in the importance of vaccines, the effectiveness, the safety, and is it compatible with my religious beliefs? Because if it's not compatible with your religious beliefs, the other things really don't matter to some people. The good news is that importance overall in the world is quite strong, but it drops considerably. Confidence drops when it comes to safety. Here, they've taken the axes of safety and effectiveness, and you can see it's quite a spread. The US is in the middle there. I'll talk a little bit about some of the other countries in your region. Could we go to the next slide? In our in the paper itself, we do mapping, comparing maps. On the left is 2015, on the right is 2018. You can see that overall, the good news is that certainly in importance and effectiveness, there has been a incremental change towards being more confident. I'm convinced that this is because in 2015, by 2015, there had started to be a global recognition in the public health community, in the immunization community, that Houston, we have a problem. As Freud used to say, you can't do something about a problem until you acknowledge you have it. So we had come a long way, because I promise you in 2005, 10 years before that, there was a lot of denialism about the fact that this was actually a significant issue that can affect vaccine acceptance and uptake. So could I have the next slide? As I said, the overall trend is somewhat going a bit more confident. And I think that's, as I mentioned, because there's been an acknowledgement of the issue. And in the last few years, there have been concerted efforts ramping up attention to, okay, we need to kind of deal with this problem. It's imperfect. We can do a lot more. But in the meanwhile, the anti-sentiments have been growing at a pace while we're catching up with the reality in the public health community. As I mentioned, safety is not as increased as others. Canada's doing a bit better, but the countries in South America that are particularly striking, and I have some numbers here. Brazil, confidence in importance dropped of vaccines dropped from 93%, 92.8% in 2015 to 88% the data was collected end of 2018. In confidence in effectiveness, Brazil dropped from 76% confidence to only 56% confidence in vaccine effectiveness. This was data from November 2018. Safety confidence dropped in Brazil from 73% strongly agreeing that vaccines were safe to only 63% agreeing that vaccines are safe. That's pretty dramatic drops. We see incremental ups and downs, but it's a very concerning trend. In Brazil, we did a lot of research in Brazil around the Zika epidemic. It was more qualitative research on how mothers were coping, the mothers who had children with microcephaly and how they were coping. And we heard a lot of rumors about suspicions around vaccines bad vaccines playing a role. But then it kind of faded, but other things have come up. And this is not a great sign in terms of the introduction of a COVID vaccine, except that the fact that there are a lot of trials going on. There's some excellent collaborations going on around COVID vaccines. If the communication is right, if you use the opportunity about that collaboration and Brazil being a hub for international collaboration and support, and somehow people feel like they will benefit, it could help make it better in confidence. It could also go the other way. But I think it is a country that absolutely needs some concerted attention. And the other one is Argentina. In 2015, 95.8% of the population, these are nationally representative samples, which is like 96%, strongly agreed that vaccines were important. That dropped down to 91% in 2018. In terms of effectiveness, there was a strong agreement that vaccines were effective. 86% in 2015, dropped to 78% in 2018. And finally, in safety, 89, almost 90% strongly agreed that vaccines were safe, and that dropped down 14 points to 75%. Now, globally, the world has looked to the PAHO region as being the poster child of positivism, but I think we can't rest on those laurels anymore, and there need to be concerted action. The introduction of a COVID vaccine is an absolute opportunity to start to build and prepare for confidence building. Next slide, please. Could we get the next one? I have a double slide here, I think. So I'm going to talk a little bit about the COVID vaccine, but just as Jose had said, this is a story about the coronavirus vaccine. I took this from the Christian Science Monitor. I thought it was a brilliant statement, but not about the vaccine itself. It doesn't exist, nor whether it will be efficacious. We simply don't know yet. This is our big challenge when it comes to developing a communication strategy. Next, please. In the meanwhile, we're asking people all over the world, would you take a COVID vaccine? Now, you'll see a number of headlines that are giving you frightening rates of people who would refuse a vaccine. The reality is, if you go into a lot of those studies, the headlines aren't that fair because they bundle those who disagree that they would take it and those who tend to disagree. We should be a bit more empathetic with the people who are uncertain. for all the reasons that Jose said, and also that we don't have a vaccine, we don't know if it's going to be effective, and we don't know safety profiles. So I think we have to be a bit more empathetic with the public, and it's good to get a read on these figures, but remembering that it may change when it will change when people are actually offered a vaccine. Here, as you can see, the orange is the bit that I'm more worried about. That's strongly disagree, and these are the people least likely to change their mind. Some tending to disagree, and those are the ones that we can still have a conversation with. I get a number of people in the public health community saying, what are we so worried about? The majority of the people believe in vaccines. Well, my view is it's not about the total proportion of the population that that is positive or negative. If our portion of the population that agrees to get a COVID vaccine is hovering around 65% when we need 70, or even hovering around 70% when we need 70, we cannot risk a 2% anti-vaccine movement. So if it even knocks down, so we have to look at this as a tipping point phenomena, because we're not pulling along the whole population to the level that we want. We can't risk losing a little at the edges in the context of COVID. You can see, could we have the next slide, please? I've also included here, that last slide was from our own research around the world, but we didn't have as many countries. We're currently a lot of surveys around the world. We're just launching a 15-country study in Africa with Africa CDC. We're doing regional collaborations with UNICEF in Eastern Europe, with some individual countries in South America, and then different with WHO in Asia. But here there's just a longer list of countries for those interested, and Peru is, let's see, doing okay, but that's where the disagrees start getting bigger. But anyway, it's just to give you another perspective on the red part of the figure is just showing us the reality that we've got work to do when it comes to confidence building. Next slide, please. One of the things we look at in our vaccine confidence project, we talk about the 3 Ps: confidence in the product, the vaccine, confidence in the provider, and then confidence in, and that includes the health provider, as well as the health services, and then confidence in the policies and the politicians. Trust is multifaceted, and we really need a trust chain. If you break that chain of trust, it can affect people. It's not always about the vaccine itself that people refuse it. It may be a bad experience in the clinic. It may be that they don't trust their government. Why would they take a vaccine provided or even particularly mandated by it? But that's not universal. So one of the things we see here is the ratio of, how much does trust in government affect your willingness to take a vaccine. And it's highly varied across countries. And you can see that here, that's the correlation. And next, please. The other dimension, which is the middle, if the last one was the policies and politicians and government more broadly, the trust in the medical profession would be our provider level. That is a more consistent. Here we see that trust in the medical profession does have even more of a leveraging influence on confidence than than government itself. But again, you need as many dimensions of trust as you can get. Next, please. Another one that I thought was really interesting, we asked this question in our global confidence study around COVID vaccine, and we have quite a bucket of different confidence questions, including asking people about their compliance with social distancing, with masks, with other things. Because what we want to understand, and also we're asking about COVID vaccines in general, because contextual trust is a huge influence on vaccines. So by asking about compliance with other control measures and background confidence in other vaccines, we can discern whether an answer on a COVID vaccine is because they don't accept other control measures and in general, or they don't trust vaccines in general, or we can see actually they're complying in those other areas, their background confidence is good. It's just a specific issue with COVID vaccine. But without that other contextual trust knowledge, we won't get clear with that. Next, please. Oh, wait a minute. The one question I wanted to point out here was we added this question of, does the country where the vaccine is manufactured matter? And actually, it was higher than I thought. 65% either strongly agreed or agreed that which country produced the vaccine would definitely impact on their willingness to accept it. Next, please. This is the combined data from our global study. We do have this per country, but not enough time to go through all the countries here. We were curious if the willingness to vaccinate in general was affected by the COVID pandemic, because there's been an amplification of anti-vaccine sentiment. We would have thought the opposite in the face of such a fatal and disabling disease. But in fact, the different groups have combined together with the anti-vaccine groups. Some of these other protest groups have amplified it. So we wanted to say, is this going to have an impact on background vaccine confidence? Not so much. The good news is only 12% said that they would be less likely to take their routine vaccines since the context of COVID. Now, that's not in the context of COVID, meaning going to the clinic to get your vaccine, but moving forward. So so far we're okay, but this is, of course, highly varied by country. Next, please. This is recent data from Pew Research Center, and what is particularly concerning, and I echo Peter's concern on this, just from May to September, the willingness to get a COVID vaccine is consistently dropped across genders, race, ethnicity, age, and education. It's really striking how consistent it is across all these domains, which is not a good sign. We've got a lot of work to do, but it also reflects what a colleague referred to as emotional epidemiology. The state of the world and the state of the pandemic in May was quite different than in September, and people are constantly weighing: am I going to take the risk of a new vaccine? How bad is the threat? If the threat seems imminent, I'll take a little bit of risk. If it's more distant, maybe I'll wait and see what other people do. So it's not, some of this shift does reflect the state of the epidemic surrounding. Next, please. As we heard, some of the uncertainty is certainly reasonable, but then we have these extremists who are out on the streets in different parts of the U.S., in Europe, as Peter mentioned, particularly in a major demonstration, 33,000, 32,000 in Berlin. London, we had it here. And in India, there were also protests against lockdown, but that was for a very different reason, and that was reasons of survival. The kind of people that were demonstrating there were people whose their livelihoods were broken by the lockdown. This is much more of a libertarian kind of the health freedom theme or two earlier. Next, please. There's also this this instilling of doubt. One of the challenges I do a lot with the tech industry, particularly Facebook, trying to think about what kind of criteria what do we need. And I mean, it's easy for governments to wag their fingers at Silicon Valley and say, shut down the bad stuff and only put out the good stuff. Well, what do you do when you actually aren't totally sure if some of the emerging information is not important pieces of information for us and for the science? And what about the way that some of these anti-groups are extremely sophisticated and clever in instilling doubt? You cannot, as a company, you can't delete things that are asking questions and instilling doubt. And there has been a trend in these anti-groups to not make statements that could be deemed as incorrect and therefore get deleted. They ask questions. This is fishy. I don't understand this. Show me the data. Next, please. I won't get into the vaccine the vaccine itself. This is from the London School of Hygiene, tropical medicine. We have a COVID-19 vaccine tracker just to see what's happening. And you've already had an excellent overview on that. Next, please. Also, as we heard earlier in Peter mentioning that there are other deals going on despite the vaccine nationalism, and I think we also have some virus nationalism with the references to a China virus. But I mean, Indonesia with their vaccine deals with China and UAE. Next, please. Even though, on the one hand, you see headlines about scientists in Europe and the US really questioning the safety procedures in the Russian vaccine. On the other hand, you see Russia selling India 100 million vaccine doses. So, as people are focused on their own countries, the rest of the world and the developing world and the South to South arrangements are moving ahead. Next, please. But as we also heard earlier, it's highly unlikely we're going to have, who knows, but we're certainly not going to have 100% effective vaccine. And depending on, even if we did, we can see from some of the previous slides that not everyone's going to accept it. So we cannot drop our guard and rest on our laurels for the holy grail of a vaccine. We may have no vaccines, and we also have to be careful with creating expectations. I think it's unlikely that we won't get at least one vaccine, but the reality is we'll probably have a few candidates, and some will have different safety profiles than others. Some will have different efficacy. They're made on different platforms. There are different doses. And it's one thing we should preempt is absolute confusion by the public. So we have time now. We can start to get more understanding of these different possibilities, even. Bring the public along on our journey as we're going closer to discovery. Make them feel like they've been learning along and we haven't done this behind closed doors or in a black box and then spring out with, this is the vaccine we have. We need to involve them. That kind of engagement can buy us a lot of trust in the long run. Next, please. As I mentioned, in addition to using the opportunity of building towards a COVID vaccine as a trust builder, another super important thing will be not forgetting and acknowledging the number of other health issues that publics have, to be sensitive to that, to start to get them some of the help address some of their health issues that are tangible, that are somehow routine, that are normal, that are familiar. Help get in childhood vaccine back on track. Talk to people about other health needs. Build that trust, build that relationship, build that empathy, so that and use those opportunities to start to hear the questions and start the conversation also about a COVID vaccine. But we can't just focus, we can't lose sight of the other health concerns that could leave us with other major disease outbreaks. Next, please. And then there's the flu shot. I mean, this is even from the World Economic Forum. Want to minimize the impact of COVID-19? Go get a flu shot. I mean, that is one thing that it is familiar. People know it. There's such a hunger for something that's known and familiar in this hyper uncertainty. These are opportunities to kind of rebuild that relationship, get something that's familiar. The good news is, in a lot of the new 2020 data we're getting in, we've seen a significant increase in public confidence in the importance and effectiveness of vaccine. The real issue now, in meeting with the EU last week with our EU data, and the concern was that, well, hopefully we have enough vaccines. So be ready with enough vaccines, because people are going to want more flu vaccines. Next, please. This is a book that my book just came out last month in the US and later this month in the UK. This stuck, How Vaccine Rumors Start and Why They Don't Go Away, is basically some of the stories and that I've had and experiences been through around the world in the last 10 years. And it's stuck in terms of an injection, but also stuck in the conversation between the science and medical community and the public, and thinking about ways that we can rebuild that relationship. And I think in the context of COVID, we have many opportunities. And my last slide, next. This is our website. We're doing a lot on COVID. We're still doing our routine vaccine confidence monitoring, but we're trying to also keep up to speed with, and as we gather new data daily, we're posting it on the site. Thanks so much.